Hi, hello everyone. Welcome to What Would Dorcy Do Friday. I'm Dorcy Pruter, the CEO and founder of the Conscious Co-Parenting Institute, and I'm really excited to be coming to you live this Friday. Today, I want to talk to you about suicide or suicidal ideation when it comes to this family dynamic known as parental alienation, or children who are experiencing emotional cutoffs between a parent and their child, or the child is experiencing an emotional cutoff with one of their parents due to a complex custody situation or post-divorce, and oftentimes involving the family dynamic that, with the urban term of parental alienation, but we all know that it's really child psychological abuse. And recently, the subject of suicide has really come up quite a bit, and I've seen a lot of parents, a lot of chosen parents, and a lot of alienating parents using the mental health and legal community using suicide really as an opportunity to keep the family stuck. And I want to talk a little bit today about things parents can do to help prevent suicide, some of the signs when suicide is real. And I want to talk a little bit about things that may appear that way and kind of telling the difference. And then I want to just talk about some of the communication blocks parents have, or people really have in general, but how they apply to this topic of suicide around family divorce and custody battles. So as children grow into preteens and teens, it really actually becomes more challenging for parents to know what they're thinking and feeling. And when do normal ups and downs of being a kid or adolescence become really something to worry about? And parents and family members can help their tweens and teens really cope with the feelings they have when life feels too difficult to bear, and learn some of the factors that really increase your child's risk of suicide. And I want to just talk about some things that you can do to really help you feel better prepared to offer the caring, non-judgmental support that your child really needs. And whether they're authentically suicidal or they're in protest, the concern with suicidal ideation around complex custody is prevalent. And one of the issues we see frequently with suicide attempts and threats surrounding divorce is how parents handle the threats. Some parents take it lightly. Some parents assume that it's the coaching of the other parent. Some parents blame the other parent because of the child's suicidal ideation. Some parents use it as a weapon or a last resort to really prevent the other parent from getting parenting time with the child and having the child in a state of discord or disarray or chaos. And we've also seen parents that have attempted suicide, and so they're role modeling suicidal ideation or behavior. And in these family situations, everyone reacts or overreacts or underreacts to the situation, and people go into operating from a place of fear and trying to solve things, and the child is really left stuck in the middle. And some of the common things we see is some of the common communication blocks when it comes to this family dynamic. And if you see signs that your child's mental health is under threat, it's important for you to tune in. It doesn't matter which role you're in as a parent, and maybe you're not dealing with alienation, but just as a parent in general. Maybe your child is just having a bad day, but when signs of mental health troubles or problems last more than a few weeks, don't assume it's just a passing mood. Studies have shown that 9 out of 10 teens who actually took their own life were struggling with some kind of mental health condition, such as anxiety or depression. And it's important to keep in mind that teens who haven't been diagnosed with a mental health condition may still be at risk. And this is because it can be hard to pinpoint a mental health issue in their early age. Also, it can be hard to pinpoint because you may be dealing with a complex family pathology of narcissistic borderline personality disorders in one or both parents. And when we have these complex issues, the child has the fingerprinting of the pathology of the parent. So it's really important to assess what's happening with the child and then go out. Who's causing it, mom, dad, or both? And then what else? What other conditions may be causing teen or child suicidality? And many teens that attempt suicide do not have underlying mental health issues, but in most cases, they will be giving signs that they're considering ending their own life. And so your goal should be to remain calm and alert and ready to speak to your teen. So you don't want to wait for them to come to you. You could start by saying something simple like, you seem to be sad. I'm open to talking about this because I love you and I care what happens to you. That's open versus trying to assume or psychologize the situation and tell the child. So having a open mental health conversation with your child is important. And a common communication block I see here is parents leading children to a place that serves the parents' wants and needs and not the child. For example, parents will interrogate a child about suicide or the other parent and then make the child think that the claims of suicide ideation are the other parent. So they make these claims against the other parent, and then the child wants to rise up and know it's not them, it's me. So even if there was coaching going on, when you put the child in the center like that and you place them in a position where you're blaming someone else, you're not listening to the child. You're actually putting the child in the middle of the complex custody issue or the conflict between you and the other spouse, or other parent. So parents also go into blocking communication by not listening because they're listening to blame the other parent or to solve the problem. So parents, when children are in distress or in protest, want to solve things as quickly as possible. And so some of the common things that we see are like placating the child. It's not that bad, or life is not as bad as it seems. Everything will be okay. And when people use this communication block, or parents, it's really to take away the child's pain or to make them feel better. But the way the child really hears it or interprets that is they think you believe they don't have a right to feel the way that they're feeling, or they can't handle discomfort or solving things on their own. Or you are trying to psychologize the child, right? Do you know why you said that? You're just being oversensitive. And parents do this because they want to prevent future problems by analyzing the behavior and explaining the motives to the child. So they're not listening, they're psychologizing. And the child thinks that you think you know more about what is happening within them than they do about themselves. So therefore, you're superior to them. And so they feel unheard. Or there's judgment of them or judgment of the other parent. So blaming the other parent for what's going on. And this is because you're uncomfortable or in pain, whether it's true or not. Having that conversation with the child puts them in the middle. And it's also implying to the child that they have poor judgment, that they can't think for themselves, and that they don't make good decisions, and that they're only influenced. They have no critical thinking skills or can think for themselves. And when you do this to the child, they will anchor in, they will dig in their heels. You get in the convince and resist dance. And when we're in these spaces with our children, we're not listening. And these common communication blocks escalate things for children. And what I would do instead is listen, even when your child is not talking. So don't be surprised if your teen turns away when you first raise subjects of mental health or suicide. Just keep in mind that even if your child is silent at first, actions speak even more loudly than words do. So watching for major signs in your child's sleep patterns, appetite, social activities. Are they isolating? Especially for kids who usually enjoy hanging out with their friends or playing sports, or signals of serious difficulties. So if your child is really struggling more than usual with their schoolwork or chores or other responsibilities, these are additional signs that you shouldn't ignore. And oftentimes when parents get divorced, you throw your parenting skills out the window temporarily and you bear down on your children, and suicidal ideation increases in the beginning of divorce. And if it's ongoing, if you have an ongoing custody battle and you're engaging in this conflict, it will increase in the child because they feel out of control. So when you realize that your child might be facing these risks, you might want to consider some of the seriousness of this, and then also what are the situations around that. So many parents wonder, could that really be happening to my child? Would my child really do this? And the answer is yes. So young people of all walks of life, all ethnicities, all sexual identities, all gender identity, all of those things commit suicide every year. And in fact, suicide is the second leading cause of death among young people between the ages of 10 and 24. And some of the things that cause young people to think about ending their life is the loss of a loved one to death, divorce, maybe deployment, deportation, or incarceration. So I want to say that death, divorce, deployment, deportation, and incarceration, all of those things create a separation between a child and a parent unavoidably, except for divorce. Okay. So if a child is experiencing a loss of a parent during divorce, then this is like a death or the parent being out of the child's life. They are grieving the loss of a beloved parent. It could be a healthy or an unhealthy parent. It doesn't matter. The child loves that parent. And there are other reasons that children commit suicide, everything from bullying to discrimination to family history of suicide, all kinds of other reasons, witnessing the suffering of violence or domestic violence, financial instability, suicide in their school or friend group. There's a lot of things there. But I really want to focus on the 5 main reasons is the loss of a loved one, death, divorce, deployment, deportation, or incarceration. And the most important one that I'm talking about today is the divorce. That's the one that you have the most control over. You have the most influence over. So when your child is experiencing the loss of one of their parents, they are experiencing this as an emotional cutoff, as a death. So even if the child is in the active stages of alienation, they're actively rejecting, don't be mistaken that this child hates you and that this is what the child wants. It's not what the child wants. And kids that we frequently see that go on to commit suicide in this family dynamic are ones that don't get interventions, are the kids that the suicide gets ignored. Right? The handling of the suicide or the suicidal ideation is ignored. It's not handled properly. It's reinforced by one or both of the parents that this is what's expected. It's encouraged instead of discouraged by speaking discouragingly for the child versus encouragingly. And that may seem a little confusing, but what I'm trying to say is when you open up dialogue with your child, and you listen not just with your ears, but with their behavior, you're listening from a much deeper level. You can start to see some of the signs, and try not to dismiss what you're seeing in their drama. Never assume your child is exaggerating or playing games if they say I want to die, or I don't care anymore, nothing matters and nobody's helping, and I wonder how many people would come to my funeral, or everybody would be better off without me, or you don't have to worry about me any longer. I'll stop my parents fighting because I'll be gone and there'll be nothing for them to fight over. Many kids who attempt suicide with their parents in disarray will tell them ahead of time or through others. And if you're not listening, words can indicate an urgent need for help. So don't risk being wrong about this, and be very careful in your communication. When you respond with empathy and understanding, so when your child talks or writes about suicide, You may feel shocked or hurt or angry. You may want to deny what you're seeing or argue with your child. And these feelings are natural and valid, but it's essential to really focus on your child's needs first and foremost. Your goal is to really create a safe, soft place for your child to land, and that they can trust you to listen and express concern, but without judgment or blame. Okay? So a lot of parents make a mistake. They react with, that's a ridiculous thing to say. That's your other parent talking. You've been coached to do this because your other parent doesn't want you to spend time with me. You have a great life. Why would you end it? You don't mean to do that. I can't believe what I'm hearing. All the things we've done for you. Why would you do that? You've got to manage your own feelings so that you can respond with empathy. An empathetic response to a child is, it sounds like you're in tremendous pain and you can't see a way out. Do I understand that correctly? Maybe you're wondering how life got this complicated and difficult. How can I support you? Right now, you're not sure of the answers of the problem that you're facing, right? You must really, really be hurting inside to consider ending your life. Saying this like this, empathetically and meaning it, gives the child the opportunity to open up to you about what's going on. If you're interrogating your child and they're making claims of suicidal ideation or attempts, and you're focused on it being the other parent, you're missing an opportunity for connection. You're missing an opportunity to have an empathetic response to your child, and you're reinforcing the child that they don't matter, that they're getting something from you, the interrogation, the attention, but you're really focused on blaming the other parent, and the child doesn't feel heard. Okay? It's really important that if you're concerned about your child's suicidal ideation or attempts, to get professional help right away. If your teen or your child is self-harming, or you sense that they're at risk for attempting suicide, take them to the emergency department of your local hospital immediately. Fast action is crucial when things have reached a crisis point. If you see signs of suicidal thoughts but don't sense an immediate crisis, you still need to take action. Reach out to your pediatrician or local mental health provider who treats children and teens with suicidal ideation, not just a mental health provider, somebody who really understands this dynamic, and explain what you're seeing and hearing, and schedule a mental health evaluation immediately. Mental health care providers can help you and your teen, and they can help create a safety plan that covers the warning signs or triggers that your teen feels, which lead to suicidal thoughts. Now, some of you may be saying, well, I'm a targeted parent. I don't have time with my kids. I just know this is happening and there's nothing I can do. So it's up to the other parent. And that is being lazy. And I'm telling you right now, there's always something that you can do. You can reach out to the pediatrician. You can express your concern to a mental health provider and seek guidance on what to do, on what the possible steps would be to help them cope with feeling triggered. Or seek sources of support like family and friends and teachers and mentors and other people that are in the child's environment. Have emergency contacts and steps to take if things get worse. And then if the child is coming into your home, because some people have their kids coming back and forth, even though they may be rejecting them, they're still coming on their time. Make sure you remove and secure any weapons, guns, knives, razor blades, anything that could be fatal for your child. Take pills, take away the opportunity for them to do something, especially if the child is being coached by the other parent to self-harm in your home. Don't make it easy for that to happen. Make it easy for the child to be in relationship with you, but not create a scenario that creates this gap, that the child has to do something in order to please the other parent. Make your home a safe place for them to be, okay? I can't tell you how many times we've seen these tragic things happen, and the parent was like, I just couldn't believe that this was happening, and I knew the other parent was coaching, and I didn't think the child was going to do it or attempt it, Okay, so just really be smart about these things and think about how you are showing up and the space that you're creating for your child. And then the communication with the child. I'm hiding all the guns and knives because, you've been saying this. Your mom says you're going to be suicidal, and I don't want you to do that in my house. You don't want to speak to the child that way. Then you don't even have to have the dialogue with them with regards to doing that. Just do it. And then as your child enters treatment, if the child is getting treatment for suicide attempt or ideation, focus on creating hope with your child. Your child's care team will likely recommend a combination of steps to really reduce mental health symptoms and thoughts of suicide. Maybe medication and sometimes talk therapy and stress reducing techniques such as yoga and meditation or journaling may be part of the plan. A lot of times they get it wrong and think part of the plan is to continue the elimination of a normal range parent in a child's life. And so oftentimes the parents then react and then anchor in and they fight and they come off as crazy because your child has done something and you're panicked. And it's really important for you to learn to manage your emotions and lead your communication from a place of care and empathy, compassion for your child, and working with the treatment team on reunification and a safe way to do that for both of you. You don't want to put your child in a position where they have to do these things because they're being coached to do that. So don't go to sleep here. This is a really critical, important piece of what I talk about and what we teach parents and what we see all of the time. You want to encourage your children to see family and friends. Your child may feel reluctant to spend time with you or other people, but you can explain that social support will really help them feel better. And so when they're spending time with you, you don't want to make it about them not spending time with you or the rejection or all of those things. You want to be the soft, safe place for your child to land. You want to make it easy for them to communicate with you and be with you. You don't want to make them feel bad, judge them, make them feel guilty for what's already happened. Even physical exercise helps. So doing things physically with your child, maybe playing a game of basketball or getting out and having a walk, but helping the child incorporate exercise without saying you need to exercise. You need to do these things. You want to elevate your teen's mood by stimulating the production of endorphins by engaging them in things. And maybe it's having a cousin come over and letting them do physical activity together if your child's coming on your parenting time, but they don't want to do something with you because it's the betrayal of the other parent. Encourage balance and moderation. Teens in crisis need to go easy on themselves, means adopting a realistic pace, avoiding experiences that could prove to be overwhelming for them. You want to reassure them that self-care is never, ever a sign of weakness. And everything you do in life is affected by our health. Right? So giving ourselves time to heal is essential, our physical body and our emotional and spiritual and mental body. And big tasks can be divided into smaller ones, more manageable ones. And gradually, as your child builds their confidence and their strength grows, they'll feel ready to really take on more. And just remind each other that this will take time. You and your child will benefit from knowing that progress will come at its own pace and setbacks sometimes happen. And there's part of the healing process to kind of 3 steps forward and 1 step back. And that's okay. You want to encourage your child by being patient, by being self-forgiving, by being open to having dialogue with them without implementing communication blocks that makes them believe you don't believe in them or their ability to heal and do the work. You'll both see an improvement if you shift out of communication blocks that holds the family stuck, that holds the child stuck, the implied message that you know more than them. Just remember that if you're worried about your child, you can always call the National Suicide Prevention Lifeline. It's 1-800-732-TALK, 1-800-273-TALK, 273-8225. It's a free lifeline and it's open 24 hours a day, 7 days a week from anywhere in the US. And the Lifeline team members are there to really listen and help you and find resources that you need. So ask your teen's care team for other resources in your area that you should know about. Make sure you are well versed in the understanding of suicide ideation and attempts, and be aware. Look for talking points, open up the dialogue with your child, and then be aware that you are the chosen parent. If you're listening to this, you can lead your child out of this dynamic, even if they're being coached into this space. And you do it by not being defensive about it, by not blaming the other parent, even if the other parent is doing that. You can do it by opening the dialogue, like we've talked about with the children, and give your child the opportunity to express themselves without you needing to defend yourself or judging or reacting. Just being that soft, open place for the child to land. Sometimes just getting stuff out of the container into the trash can and you take it out is exactly what the child needs to shift out of the narrative and back into a stable place. So that is What Would Dorcy Do this Friday. I hope this was helpful for you. Leave comments. If you know somebody who's experiencing this, or you know somebody who is suicidal, share this with their parents or share this with somebody who you think this might help. So I hope you guys go into the weekend having an awesome weekend. Thanks so much for listening, and we'll see you next Friday. Have a great weekend, everyone, and bye.